set up for the trolley for microneedling. So we've got your MediMD Hydrocalm Cleanser, Spectracept, your MediMD Hyaluronic Acid Serum, the MediMD Sunshield SPF Moisturiser. Then moving down to your kidney tray, so we've got some spatulas. We're going to apply numbing cream with these. We have the microneedling pen that we'll go through later. Your 12 needle cartridge. Some cotton pads. A disposable headband. And then your Topper 8. These are your gauze. So we've got 2 pieces of bedroll here. So in the centre we're just going to tear down to create a bib. So then I'm going to place this on the client to protect their clothing. Obviously we used a towel with dermaplaning. Really important with microneedling that we're using things that are disposable just because there could be blood present in this treatment. So now we're going to cleanse the skin. So we're going to get a few pumps of the Hydrocalm cleanser and work this into the hands. And then we're going to apply the cleanser to the face. So nice soft hands, working upwards. And then we're going to get some water onto the gloves just so that we can work this in. So nice fast circular motions, working that cleanser in. These are ring fingers onto the top lip. And we're working into the nostrils, onto the top of the nose, and then circular motions, nice and fast. And forward. And then we can come to the temples, pause, and remove. So now we're going to get 2 cotton pads. We're going to dampen these, wring out the excess. We'll remove the cleanser. Again, if you've got quite a bit of makeup on, if you just turn the pads to the other side. And working outwards. If they do have makeup on, with microneedling, really important to double cleanse to make sure all that makeup is off. So now we're going to apply the numbing cream. So we've got the spatula. I'm going to apply that onto the spatula. We're then going to apply the numbing cream onto the skin. So we start from the forehead. Just want a nice thin layer. Into the nostrils, to the nose. Might need to put some more on. Then we'll put the lid straight back onto that numbing cream, and then we'll leave that for about 10 minutes. Once the numbing's been on, we're then going to remove. So we're just going to get 2 of our cotton pads, dampen them. And then we're going to remove the numbing cream. So with this, we might need to do it in sections. It's much thicker, so you might need to just re-dampen these pads. Perfect. And then once we've gone over them, we're going to get 2 gauze. And we're going to get some Spectracept on these. So we're just squirting onto the gauze. Enough so they're nice and damp. And then we're just going to wipe over the skin. So this is sterilising the skin. Again, nice strong movements, making sure that we're really getting all of the areas of the skin. So now we're going to apply the cartridge to the pen. So this is your MD microneedling pen. As you can see, we start off at 0, and as we twist, we go up in increments to 2. So we can adjust it as we go along. So we'll keep it at 0 as we're starting. Got a little button here. If you hold that down, it turns the pen on. And as you can see, it goes up to number 5, and that basically increases the intensity of the vibrations. So we're just going to hold that down, and that turns the pen off. Here you have the cartridge. So again, like we said, this is a 12 needle cartridge. Here you've got your expiry date, lot number. We take a picture of this, obviously, before we did the treatment for your insurance purposes. Then we'll poke it through the paper, like so. This then goes into the pen, and we twist it to secure it in. So once it's fully twisted, it can't go any further. It's now secure in the pen. So we've started at 0 here. We're going to change the depth to 1 millimetre for Tash. She's had the treatment done before, so we know that her skin will be able to take a 1 millimetre depth. We're going to pop the pen on, up to 5 vibrations, the highest intensity her skin can take it. And then we're going to start off on the cheek. So we're starting close to the ear, and we're going to start cross-hatching. So we'll start off vertically, and we're just working across the cheek. Now we're going to do half of the face first, and then we're going to do the other half, because with the hyaluronic acid serum, it does tend to soak into the skin. So we want this to be present on the top of the skin so that it can help with the glide of the pen. As you can see, the head is in contact with the skin at all times. We're not coming off the skin. And we'll go diagonally. And then we can go horizontally. Nice and quick. And then we can come up onto the apple of the cheek. Like so. Once we've completed the cheek, we're then going to change our depth. So for the chin, we're going to come down to a 0.25. And we're going to split it into 2 sections. So we're going to start off on our first section. gliding backwards and forwards over the area. And then if you could pop it into the centre for me, and then we'll just do this little section here. Once we've completed the chin, we'll then move on to the top lip. And it's nice, long gliding motions on the lip. If your client had an area of concern in this area, so say for instance they're worried about maybe a fine line, we could do stamping. So at 0.25, we would just press up and down on the area. And we can do this up to 10 times. So we can move along. And this is just basically a more intense version of the treatment. So once we're finished there, again, still at 0.25, we're going to come onto the nose. So we can do small circles in the area of the nostril. And then we're going to come on to the top area. Now, this is a really bony area. Some clients can find it a bit uncomfortable, it can make them sneeze. So if you just hold the tip ever so slightly, and then we're literally just gliding, tickling that very top of the nose. We don't want a lot of pressure there. And then gliding down. We're then going to come onto the under eye, nice long glides under the eye area. So nice long strokes onto the under eye, and then we're going to come up onto the forehead. So this part, quite a lot of your clients might find a bit uncomfortable. It is very close to bone, so we're going to go nice and quickly. Small sections, back and forth. Making sure that all that head's in contact. Now we're going to do the other side, so we're going to pop our serum on. Plenty on, so we've got that glide for the pen. So in this side we're going to do a different technique, so we're going to show the circles. Nice circular motions, keeping the pen in contact, moving along the cheek. Be careful at this depth not to go too high on the cheekbone. Gliding over the skin, really working that serum in. Now we're going to adjust down to 0.25. Ask our client to just pop their head ever so slightly this side, and then we'll do the circles into the chin. Going to glide back and forth on the top lip. The circles can sometimes just be a little bit too much for the top lip, so we'll stick with the back and forth, and then again circles onto the nose, support the tip, and then we just really lightly and then like the other side, gliding, nice big movements under the eye area, and then work up onto the forehead. So once we've finished the treatment, we're then going to hold the button down, which turns the pen off. We're then going to remove the cartridge by twisting off the pen, and then we will go and take that to our sharp spin. So once we've finished the needling treatment, we're going to grab some more of our Topper 8 and we're going to sterilise the skin. Now just remember that we have used numbing cream, so those capillaries have constricted, so the redness might come out. So just let your client know, they might notice that that redness still comes out in the skin after the treatment. Now we have had blood present, so these are going to go into our clinical waste bin when we're finished. So just remember that any waste now that's at the bottom of the trolley needs to go into the clinical waste bin. We're now going to apply our serum, so get a nice full pipette into the glove, work it into your gloves, and then we're going to press on. If you're using the antioxidant one, just let you know it might sting a little bit, so do warn your client that it might tingle. But the hyaluronic acid one should be absolutely fine. So just pressing in, don't to rub the skin too much. And then we've got our MediMD Sun Shield Moisturiser with an SPF 50. Again, one pump is enough. And then we're going to pop that on the skin. This one does need rubbing in. Obviously it does have a little bit of a white cast to it, so we're just going to work that into the skin.